Hello friends, I'm Dr. Anurag Shrimal, liver, pancreas and intestine transplant surgeon and HPV surgeon. My area of expertise includes adult and pediatric liver transplantation, pancreas and kidney transplantation, intestine transplantation and complex hepatobiliary surgery. Friends, a lot of misconceptions and myths surround the field of liver transplantation. Let's talk about each one of them at a time. First, it is assumed that liver transplantation is too risky. Is that true? According to me, not at all. With the progress in science, technology, with advancements and refinements in the surgical technique, the ICU care, as well as the improvement in immunosuppression medication, liver transplantation has become an extremely safe surgery. Around 95 to 97% of my patients get better and are discharged from the hospital, and more than 90% of my patients are doing well at 1 year. Imagine with a life-threatening liver disease or a liver cancer, more than 90% of the patients doing well at 1 year. How do we call it as a risky surgery? A very common myth is that you can't live a normal life after liver transplantation. Again, absolutely a no-no. Remember friends, what I say is liver transplant adds life to life. It's not just that you are living a long, healthy, productive life. जैसे मैं हिंदी में बोलता हूँ, एक सक्षम, स्वस्थ, सुदृढ़ जिंदगी जहां आप अपने परिवार का पूरा वहन करते हैं. After a liver transplant operation, the first 2 to 3 months is the period where you are recovering from a major surgery, where the new organ is getting accommodated in your body, where the immunosuppression medications are at their peak and they are being tapered. From your transplant, over the next 2 to 3 months, the dose and the number of these medicines have decreased significantly. Most or almost 90 to 95% of my patients are back to normal life at around 3 to 6 months from their liver transplant surgery. This normal life includes physical activity, physical exercise, a normal regular diet, as well as back to work, taking care of your full responsibilities as an adult. Friends, a common myth in our country is that liver disease is always caused by alcohol. That's completely wrong. The most common cause for liver disease now in our country is fatty liver disease. Our country has become the diabetes capital or the capital for metabolic liver disease in the world. Every third or every fourth individual in the society is suffering from fatty liver disease. Don't ignore it. It's very significant, very serious. Now we are facing the challenge of childhood obesity and childhood fatty liver disease, and that's still more dangerous. So friends, the common causes for liver disease includes fatty liver disease as the number 1 cause in our country, hepatitis B and hepatitis C viruses. Then comes alcohol, autoimmune liver disease where your body is fighting against your liver. That includes AIH as well as a spectrum of disease, what is called as PBC, PSC. Then Wilson's disease, it's a genetic disease or an inherited error of metabolism where the protein ceruloplasmin is not produced by the liver and the copper accumulates and leads to toxicity in the liver as well as other parts of the body. There are certain other conditions that can severely damage the liver in a very short span of time and lead to a condition called as acute liver failure. So it's a myth that alcohol is the common cause. As I explained, it is one of the causes, but there are many more important causes for liver disease and liver failure and the need for liver transplantation. Friends, a common myth is that return to normal life is not possible after liver transplantation, and especially pregnancy is not possible after liver transplantation. Completely wrong. In around 1 to 2 years after recovering from liver transplantation, your body comes back to normal and you are able to take care of every need of your body. In the young, healthy women or the childbearing age group patients, there are certain diseases which can cause liver failure or cirrhosis of liver. After a successful liver transplant, they can very well have pregnancies, and not just pregnancy, it's a safe pregnancy. All that is needed is to continue monitoring them, certain change of medications, and as we discuss always, a healthy hygienic lifestyle, and with that you can have a safe, successful pregnancy. I can tell you about my own patient, a young girl suffering from Wilson's disease, came to us in a very bad situation. The family was very motivated. She underwent a cadaver liver transplant around 4 years back. Last year she conceived, and this year she has delivered a healthy baby, and both the parents and the child are doing well, and the family is extremely happy. Friends, one more common myth is that a liver donor is severely affected and cannot live a normal life. An absolutely wrong statement or a myth. And let me explain you why. Liver is a special organ in our body, and it has got two very good properties or two unique properties, which is reserve and regeneration. Reserve means that I can remove 70% of my liver, or I can donate 70% of my liver. The rest, only 30% is enough to keep me alive. Regeneration. The liver regenerates. In a short span of 1.5 months to 3 months, the remnant liver regenerates and becomes almost equal to the same weight as what was there in a donor before liver donation. So a donor surgery is a very safe surgery. A donor is completely evaluated. The liver regrows, and other than the scar of surgery, there is no problem to the donor. They live a long, healthy, productive life. I have so many donors, young boys who have donated, who are athletes, young girls who have donated to their parents. Now they are married, they have got children. We have got adults who have donated to a near and dear family member and are the earning member of their family and are taking care of all the responsibilities of the family. So it's a complete myth that living liver donation is unsafe or that the donor life is miserable after a living donation liver surgery. Friends, one more myth. Liver transplantation is reserved only for adults. Completely a myth. Remember, children are not miniature adults. Children are different. Children have got a different set of diseases that affect them. The common ones being biliary atresia, metabolic liver diseases, liver tumors in the form of hepatoblastomas or acute liver failure. Liver transplantation can be performed for the youngest of the young kids, and we have done liver transplants for as small as 6 months or 5-month-old kids, as well as small as around 3.5 to 4 kilograms. Friends, I can tell you that in the last consecutive 50 pediatric liver transplants, all comers, we have had 100% results and 100% discharge rates. So it's an absolute myth that only adults can undergo liver transplants. Kids can undergo liver transplants very safely with very good outcomes. Friends, one more myth. A blood group match is an absolute must for living donor liver transplant. Yes, it was right in the past, but with advances in science and technology, now we have got medications and processes through which we can transplant the livers across the blood group. So to give you an example, suppose a patient is blood group A. The donor is blood group B or AB. In normal circumstances, the patient with the blood group A has got antibodies to fight against the blood group B. So in the normal circumstances, blood group B or AB cannot donate to A. But now with advances in science and technology, we can administer medications. So the medications, the name is rituximab. It is administered around 10 days to 14 days before the proposed date of liver transplant surgery. And what it does is it reduces the production of these antibodies. By around day -5 or around 5 days prior to surgery, we monitor the titers of these antibodies in the blood group of the recipient. If the titers are high, we do plasmapheresis or at times use specialized columns called as immunoadsorption column to specifically adsorb these blood group antibodies and create a favorable situation or a favorable environment in the recipient to accept an incompatible blood group liver. In the next few weeks to around 3 months, this incompatible blood group donor liver is accommodated in the body. And with advances in the science and technology, with advances in medicines and the processes called as plasmapheresis and immunoadsorption, this process of ABO incompatible liver transplant has become very safe. We have a long series of these patients, and we have a series not only in adults but also in pediatrics. And I can proudly tell you that the youngest patient to undergo the protocol for ABO incompatible liver transplant also is done by our team. So friends, ABO incompatible, sometimes called as against the blood group liver transplant, can be done safely with extremely good results, with very good short and long term outcomes. Friends, one more myth about liver health is that traditional medicines or home medication is safe. That's very, very unsafe. Let me tell you that the allopathic medicines, please don't take it without prescription. Please take it only under supervision. Simple medicines like paracetamol for headache or fever, if taken in overdose, can damage your liver. One very important topic that we have seen in our clinical practice is that whenever a patient develops jaundice, certain traditional medicines or certain pudiyas are being given to these patients, and they are sometimes extremely harmful. Remember that most of these jaundice which happens in a healthy individual is caused by self-limiting viral diseases, hepatitis A or hepatitis E, and they will settle down in just few weeks. But by taking those pudiyas or those packets without the scientific knowledge of it, or the so-called traditional medicines, we have seen these self-limiting liver diseases getting precipitated and moving into a wrong direction, and these patients leading or coming to us with what is called as DILI, drug-induced liver injury. There are scientific papers coming in from Kerala where the doctors actually went and did a chemical analysis of those pudiyas and those kadas and found toxic chemicals, found heavy metals as well as toxic hydrocarbons in them, causing damage to your liver. A very important research paper came from Mumbai where excessive use of giloy in the form of giloy kadas led to autoimmune liver disease. So friends, do remember that a healthy liver lives in a healthy body. A healthy lifestyle, avoidance of alcohol, daily exercise, good nutrition are the key ingredients to liver health. And please don't take any medicines without medical supervision or any of the alternative medicines without the proper knowledge of it. Thank you. Thank you friends for watching my video about the myths for liver transplantation. Do like and subscribe my video. Do look forward to more and more videos about liver health, liver transplantation and the journey after liver transplantation. Thank you.